different ways you can use your inclinometer and other strategies for looking at the flexion and the extension of the thoracic spine. I'm going to show you one screening as far as like rotation. Rotation is usually coupled with extension. So this is courtesy of the SFMA and Selective Functional Movement Assessment, and they've done a really nice job in recent decades in validating this test as far as its reliability and validity, as well as against, I've seen one study that's done it with radiographs as well. So you're going to go forearms together, and then he's already rocked back, so go ahead and put your so I usually have him start in hands and knee position. I'm going to have him rock back. Yes, knees and hips can be limiting factors for this. In other instances, I will have them sitting and they can be flexed over the table. Would be an alternative if he didn't have the healthy hips and knees that he currently is demonstrating. One arm is going to go behind his back. And then Kobe's, again, a great example because he's not super flat through here just because of his muscle bulk. I'm not really trying to put his hand as high up on his back as I possibly can get. All I'm doing is I'm just wanting to lock out the scapula so that it doesn't contribute to my measurement. So I actually just pull him down and put the back of his hand on his sacrum. And then now he's kind of, as he goes through his rotation, I used this description of Kobe, you're like kind of imagine you're in a barrel, and then I want you to go ahead and rotate, and I'm going to come over and be his constraints. I'm going to just be a wall here, and I'm going to be a wall here, and then ask him to rotate as far as he can to his right. And so I get a gross assessment as to how far he can go, and then I'm going to have him do it a couple times. So Kobe, as you go back down. So now that he understands the concept, then I bring my phone back in. I try and get it right around T4. That may fluctuate depending on their kyphosis. But what I want is I want the edge of my phone to be as flush against his torso as possible. Kobe, when you hear the beep, so there's a setting on here when I hit it, and my volume's down, let me turn it up. When you hear the beep, Kobe, you're going to rotate as far as you can. Go ahead. And he's at 40 degrees. And ideally, we would want to see closer to 50. Right? And then the third time that I do it is passive. So Kobe scooch towards me. So I bring him to the edge of the table. If it's high like this. The back of my hand is on the front of his pec. Okay. And then he's going to give me dead weight. I'm going to block his hip with my hip. And then I'm going to kind of spin him on axis. Right? So I can get him much further than he can get himself. Right? So first mobility, then motor coordination. We don't know which one it is. But the fact that I can, because we have to look at the other side. For time constraints, I'm not going to show the other side. But this is, I would want this to be normal for a healthy extension and rotation of the shoulder.
Do you want them to protract the weight-bearing shoulder?
You were talking about this?
Yeah, I thought FFNA they were the other. Would have you protract, because then you have a stable base and you can move better.
Oh, that's interesting. Yeah, I haven't. No, I don't do that. But perhaps areas for improvement for myself as well. But no, I usually will just pivot them right over that. Yeah. Okay. We're not gonna. Yep.
Are you pushing down with your left hand on the scapula?
No, it's really just stabilizing. Yep. It's like almost like an assisting, like kind of turn a big steering wheel of sorts. Alright. Yes, we won't break that one out, but it's there, and I encourage you to utilize it. And then JC.